That's 101.1 FM, AM 1160, and WCCSradio.com. We were just comparing our commutes and our lifetime commutes, where we have had to drive from to get to this point right here on this Thursday morning on Indiana in the Morning. Our conversation this morning with David Antolik from S&T Bank and with Heather Reed from the Indiana Healthcare Foundation, brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. It is a really big deal what IRMC is doing. They're putting up the behavioral health building. The behavioral health project is very, very ambitious. And David, S&T Bank knows how important it is, and you guys wanted to jump in on it, didn't you?
Yeah, absolutely. So, a while back, a group of community leaders got together and said, what are the priorities for Indiana County and the region? And this was at the top of that list. So, we at S&T serve the same community that the hospital serves, that the regional medical center serves. So it's so important to us to be able to support the community and the people who live in that community, our employees, our customers. And I want to recognize with Heather here all the work that she's done in making this happen, all the work that Steve Wolf, the board at the hospital, in raising first the awareness around this need in the community, and second, bringing the community together in funding this project. And we're just pleased and honored to be a part of it.
A gift of $500,000 to this particular project. Heather, we've talked with State Representative Struzzi about this. He's very much in on the mental health issues. We've talked with guys like Dr. Ralph May about the mental health problems, and particularly the way the structure is set up in the state of Pennsylvania. There aren't very many facilities such as the one that's being built here. This is a great commitment by IRMC.
Huge need. And, I think to Steve's point, such a great need, such an identified need by our leadership team, our board, that we went ahead and broke ground before we had all the money raised. So I think, in terms of historic projects and how we typically raise money, this is not how we go about raising money. But because the need was so great, the fact that we just couldn't wait another day to make this happen for our community, bringing this to fruition is vital to so many people in this community and our families, that we said we just got to do it. We'll raise the money. That makes it a little bit more difficult. But when we have such great community partners and leaders like S&T and Dave Antolik that say, we support you, we recognize the same things that you do, we know that this is so important to our community, we're going to help you get there, even if we've kind of jumped in all in, before we had raised the money. So, from our standpoint, being able to kind of pull these big people together in these large leadership gifts is so incredibly important to helping us get over that finish line and get the project finished.
As it is now, when folks are identified as having a real mental difficulty, they are a lot of the times just taken to the emergency room and they're dropped off there. And there's no place else for them to go. This is going to address that need. And David, I think it's so important that the way this facility, this project is set up, there are specific programs for adolescents, for adults, and for geriatric patients as well.
Correct. I think a big part of community service and giving back to the community is serving the entire population. And you just mentioned some really vulnerable segments of the population. They're going to be served by this much needed asset. So when we think about the community, we don't just think about the employees and customers. We think about the community at large and being able to serve this specific population where there is greater need. That also taxes the infrastructure that already exists, right? Yeah. So this is an additional asset that's going to allow the hospital, the regional medical center, the community to serve a wider, broader swath of the community and the people who make it so great.
It's very interesting to me, actually, the number of institutions such as yours here in Indiana County that see needs and don't just say, "Gosh, that's a need, and someone ought to do something." There's a very large step, we understand, between saying somebody ought to do something and being the group that does something. But we think back to the Chevy Chase Community Center and their need that came up in October, and the Fill the Bus program. S&T Bank said, hey, let's jump on board with this. Now comes this. It really is part of a commitment, as you say, to the entire community.
Yeah, it's so important to be able to have those conversations, identify those needs, and I've lived here virtually my entire life. Being in a smaller community like this allows us to be nimble, and flexible, and get people together to have those conversations and agree to priorities. And then, having folks like Steve and Heather to put it together and say, look, this is what we're going to do. This doesn't happen in large communities. I mean, it's much more. The process is much more in depth. It's longer. It takes a long time to build consensus. We're lucky. We're incredibly lucky in this region to have, community leaders like the folks at First Commonwealth and Ruskini and the Kowalczyk family who can come together along with folks like me and S&T to be able to say, this is the priority. We need to get this done. This is why it makes sense. Let's do it. Let's get this train in motion and get this happening, instead of waiting for some bureaucracy to grind things to a halt. And the other important element here, too, is you mentioned Jim Struzzi, Joe Pittman, the representatives that we have, the center and the representatives are incredibly critical to driving this community forward. So, beyond just the regional medical center and the behavioral health building, there's a really bright future for this community. And I believe in investing in it, personally and through the company that I work for.
I think it says a lot as well for the type of people who populate the board of directors, because without your board recognizing it, without the right quality of person on that board, maybe this doesn't happen someplace else.
Yeah, I mean, in terms of the bank, it's fundamental to who we are. We're a people-forward company. We talk a lot about that and why we exist. Well, we exist to serve people, and that means our community. So it's a rather easy decision. I mean, the dollars are not easy to come by, right? The economic realities of being a publicly traded company and the competitive environment and all of the things that you hear about in the various industries that exist in Indiana County, there are challenges there, but being able to say, hey, this is the right thing to do, that's the easy part. Raising the money is the hard part, right, Heather?
It sure is.
But that's where you come in. The Indiana Healthcare Foundation, you look at needs, just as Dave says, they're looking at what the community's needs are. You have a special perspective at IRMC on what the needs are within this community. But not just within Indiana proper. IRMC has an increasingly large footprint, and to be able to offer this is going to be a regional game changer as well.
Absolutely. I mean, we're going to be a one of a kind facility within the region, and as most people know, currently we can only have geriatric inpatient mental health, and what this building is going to provide is an opportunity for people in the region to come and get care, all the adolescent and adults, which are two populations we can't serve at this point in time. So to be able to meet that need, and in the greater sense for the larger community, for the larger region, is so important to where we're going and what this community needs as a whole. We've talked before about just the growing mental health crisis in this country. That trickles all the way down to us locally. And, this is something I think there's a whole lot of pride for a whole lot of people, and that includes some of our leadership gifts. And Dave was kind enough to mention some of our other leadership gifts that we haven't come forward with yet. But this doesn't happen without, the leaders at our community partners that say, hey, we want to make this happen. We know this is so important for our community in the future and where we're going. Fundraising does get harder and harder because we have so many priorities that we're fundraising for, but, we are so grateful at the hospital and our leadership team that we have people that are willing to step up and say, we're going to get there. We're going to help you get there. This is so vital to what we need. And we're going to be a big part of that.
I think it's important to say as well that the new building isn't going to be a house of magic, that when you walk in, you're going to see a whole bunch of folks who are maybe even new to the community, mental health professionals. This increases the mental health professional population here in our area. And new folks are going to be coming in. They're going to be such a great help in this community.
Absolutely. I mean, we know providers are scarce. We know there is such a great need that finding a really good mental health provider is difficult at best. So this is one of our hopes, is to increase that awareness, bring more providers into this community, have care readily available for those that really need it.
The building itself scheduled for completion and opening for operation in the fall of this year.
This year, fall of this year. I mean, that is incredible when Dave is talking about the rapid transition and how quickly we make things happen. Being able to break ground and go to completion, this quickly is a pretty amazing thing to see.
Well, we were just talking about how difficult it is just to get across town.
Right.
To get a building up and running that quickly is really phenomenal. And only through gifts of organizations such as S&T Bank does that happen. David, our thanks as a community to S&T Bank for stepping forward for this. When things have been identified as great needs within a community, it's usually folks like you who step forward. S&T Bank, it's an entire family. It's an organizational commitment that you make.
Yeah. Well, thank you for those kind words. And it's just an honor to be able to participate in something like this. And we all think about our legacies at some point of our lives and what we leave behind and the betterment that we do as part of being a fellow human being. Right. That's really what this is all about, doing the right thing.
Yeah, absolutely. David Antolik, S&T Bank, Indiana Healthcare Foundation, Heather Reed with us this morning. Thanks both for taking the time to come in here. For some of us, it took a little bit longer. Just
not pointing any fingers.
Right on time.
Always punctual, Todd.
Managing the traffic system here in that's the next thing, Dave. Let's get on that.
Yeah, well, that.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com.